everybody, my name's Son, and I'm going to be doing the dentist part of A Day in the Life.
And my name's Nam, I'll be doing the doctor part of this.
Oh, no jokes this time, huh?
No, I know. For the first time.
So, just to show you about what we're going to talk about. So first it'll be what we did to get to where we are now, a little bit about what goes on in uni life for a medic and a dentist, and then the nitty-gritty of why you're here, what happens after you graduate as a medic, and what happens after you graduate as a dentist. Now, I think looking at the both of us, we're pretty similar in who we are, similar education, similar food from our mom. So it's an interesting way to think about two people who chose slightly different fields in the healthcare profession and why we went down these paths. Yeah. So, who are we? Well, as we said before, my name's Nav, and I studied at Newcastle. That's where I did my undergrad, my medicine degree. I also did something called an intercalation. I'll talk about that later on in global health. Now I'm working as a junior doctor in a place in the southwest of London called Guildford. The hospital's called the Royal Surrey. And in terms of other organisations I help out with, is one involving refugee work and one involving at-risk youth groups. So for me, I graduated from King's College London a couple of years ago and did my training outside of, just outside of London, southwest London. I'll touch on to what that involves in a little bit. And as of right now, I work in something called MaxFax in UCLH in Great Ormond Street. What MaxFax is basically anything to do with the head and neck. So trauma, you break your jaw, we'll be the guys that fix you head and neck cancer and also some teeth as well. I do some general dentistry stuff on alternate weekends, as well as some stuff with the Army Reserves. And on top of that, when I get some free time, I do some stuff with the British Dental Association and some local dental committees. Now, within all this, there's work, but also play. So we do have some other outside interests. You know, I like to brush my brother's teeth when he forgets. Really
That's
important.
True. I would say this probably takes our mainstay.
Yeah.
That probably takes most parts.
Yeah.
Everything else that's the side.
Yeah.
Anyway,
Let's go.
so I'm going to tell you about my sort of like uni life. And we're going to start from day one. So this is me and Son, just outside my medical school, still not able to grow a beard. I'm sure you will agree with that. And then this is me a couple weeks ago on on-call shift. So we're going to talk about my uni life right now, the medic timeline, if we want to use that phrase. And in uni, obviously, studies are a big part of it. Sometimes you're going to feel like this. Sometimes you're going to feel like this, and your friends are going to embarrass you on social media. Now, Factor may talk about this on a lot of his courses. Actually, I'm sure he will. But your education will be based through lectures, which are basically big classrooms, or PBL sessions, which are smaller. And I'm sure Factor will educate you all on that at some point. At some point during your 5 years, you'll also do a placement year where you go into the community and go into hospitals, which is that picture on that side. And you see actual patients with real diseases and conditions instead of just you reading your notes. So obviously university has a lot of opportunities to do things outside of actual studies. So you can get involved with different charities. I fenced with a sports team over there. Get involved in like musical theatre. And beside all the extracurricular stuff, obviously it's really important to socialise with your friends. So here's us a couple years back. And I think what's important is this was the last sighting of Factor's hairline. If you do see it and you find it, please let us know because it's currently missing.
I think I actually predicted it in this picture.
Yeah. If you want to be Factor,
true.
That's all you need. True. All right.
Anyway, that's the one Factor joke we were allowed.
Yeah, that's it.
Yep.
You guys are unbelievable.
Once Factor talked about doing an elective in the US. So basically, an elective is a chance for you to learn in a different healthcare environment. Many different professions might do it. Might call it an Erasmus, for instance. For medicine, you can either do that in the UK or you can go elsewhere. So me and the Newcastle bunch, we went to Sri Lanka for a couple months, and over there you get to see how medicine is practiced differently. You get to interact with some of the locals and get involved in some things which don't really happen in the UK. It's quite interesting to compare your experiences. Intercalation, talked about that before. It's a chance to take a year out to do something that's not necessarily related to your course. In my case, kind of was. I did in global health. But you don't have to do that. You can work in a lab, you can work in business management, etc. You name it, you can do it.
Just touching on that slide a little bit, because I don't actually have it in my dental bits. A dentist can integrate in their year, but it's very rare too, so that's why I didn't put it in. But
yeah, good input, son.
Thanks. Yeah. Try
so overall, that's what happens. That's your rough medic timeline. All in all, as an undergrad, never done a degree before, that's 5 years. If you've done a degree before that, becomes post-grad entry, that's 4 years. Obviously, if you intercalate, that adds 1 year. Off to you.
Okay, so I'm going to touch on the dental bits of that timeline in uni. The application, I'm pretty sure you all know about it, and it's pretty much unanimous, the same as how a medic does it, except there's no BMAT, it's UK CAT only. The only reason I wanted to put in this slide is because there are other little pangs or monikers that you might want to add in, and that comes down to manual dexterity, which is basically how good you are with your hands. When it comes to the interviews, there may be chances to showcase this, so I painted these little guys, and I brought those into my interview. They're about here. But there's all sorts of things you can do. You don't have to necessarily bring it in. It could be you playing a musical instrument. It could be some paintings that you have pictures of. Just something to bear in mind. A lot of dental schools now are shifting towards MMI style of interview, and it's not in the remit of this lecture, and I'm sure you can go over it in the crash courses that Bacta holds in the winter. I'll be running the dental sections there, so you can feel free to ask some questions and come back there. But yeah, they make you do some interesting stuff there. I remember in my Glasgow interview, I was playing with Play-Doh, and then I had to assess my own skills of Play-Doh. That was a bit weird. But yeah. So in terms of the studies that you get in dentistry, very similar in the first couple of years as medicine in terms of learning to the general bodily systems. But quickly, you depart from that and you start building on your clinical skills. The way you do that is practicing on extracted teeth, so real live teeth that you set into a model. And based on that, after you gain your competencies, then you start moving on and treating actual patients. Some of the exams that you have are based on your actual work. So this is a poster that I presented at the end of my second year in something called a license to cut exam, basically meaning I'm allowed to touch people with a drill. One of the things to bear in mind, and this is often a question that gets asked, which is why does dentistry take 5 years if you're just in one part of the mouth, or one part of the body, sorry? Well, if you think about it, it takes about 6 years before you become independent in treating your own patients and being the lead of their care. And if you start thinking about it in terms of medicine, it takes maybe, 10 years to do?
Well, I'll get onto that, but you definitely don't have as much clinical responsibility getting fresh out of the gate of uni as dentists do.
So if being hands-on is very much your thing and having autonomy, dentistry is a very, very practical degree. And just like with any uni, plenty of opportunity to get involved in extracurricular stuff. The one thing I will say that no medic school will ever have is something called BDSA.
It's a non-event, really, let's be honest.
So there are only 14 dental schools in the country, and what happens is twice a year we meet up for 2 events. One is BDSA Sports Day, which is a really good chance to compete against each other and show who's the best. Sheffield also always wins. And then the other 2 is a conference, which is a bunch of lectures, and then a little bit of a party, obviously only study. But yeah, lots of things you can get involved in. There's some outreach there and wanting participation from other schools, showcasing like charity events, and then maybe even some Spartan races if charity and running is your thing. Now, just like how medics get an elective, dentists get to do it too. I went to 2 weeks in the Amazon, treating some people, taking out some teeth, and essentially seeing how care is done in a very, very different place to the UK. But it doesn't have to be practical. You can go see how they do it in Boston, all over the place. You could even say in the UK. But it is still an option that many dentists choose to take. And
all right, over to you. So here's the part which I'd not say that you weren't paying attention before, but I'm going to try and hone in on people who might have missed out on work experience stuff and talk about what my day-to-day life is now. So a normal day shift. This is how, as an F1, you'll spend most of your time. You'll come in and you'll prepare the list. Now you'll hear the phrase "list is life" often, and basically what that means is that is a very detailed list of all of the patients on the ward with all of their medical history, their bloods, etc. You name it. It's on that list. And as the F1, you're basically in charge of making sure the ward runs smoothly and efficiently. So admin, it's a very admin-heavy job. 8:30, the ward round will start, and you'll go along with your senior doctors. So in the old namings of doctor grades, I'm a house officer, a HO. I'm not going to say that out phonetically, but you get it. SHO, a senior house officer, is the grades just above me. SPR is a registrar, and so on. You go around with those guys, you create a list of jobs with the patients that you see, and then after that, you split up all those jobs amongst your team. If you get some time, then you will go for lunch, and then you can go for teaching if that's happening. And then you go back on the wards and you sift through those list of jobs. And that could be taking bloods for somebody, reviewing somebody, sending a referral to a different team. As you're approaching the end of the day, you need to make sure you've done all your urgent, really important jobs. And if anything can wait a day, if it's not that urgent, save it for tomorrow. And then a really key thing is to hand over any leftover important things to the on-call team. And as you can see here, there's a lot of need to be an effective communicator and being very organized, all very key features to be not just a doctor, but any member of a healthcare professional team. Obviously, throughout this, you're going to be contacted by the MDT. You may or may not have heard of that term before, but it's a multidisciplinary team, and it's anyone involved in the healthcare process that takes care of your patients fall under that term, and they can contact you if they have questions. Around about 5 o'clock, let's say that's home time, and then you'll wrap up and leave then. Bearing in mind, I've never left at 5, and I'm sure most of the healthcare professionals in this chat probably haven't either. So this is a very loose day shift, let's say. So outside of hours, when you're on call, you're seeing patients that aren't on your ward, that are not familiar to you. So here's just a list of different presenting complaints and features of patients. This is a real list, by the way. Obviously, medicine is very varied, I should say. In the midst of the pandemic, it's been a bit COVID heavy, but you can scan to the bottom and see we have some variety still.
Did you do an assessment on that person? But you loved it.
That one. I helped. Anyway, so on call wise, you'll be having a bleep, a pager, and nurses or other healthcare professionals will contact you on that bleep if they have any concerns. So here's an interim F1, just finished her first shift using a bleep and appears to be happy. So that's good.
The NHS will beat out of us.
Medicine is weird and wonderful, and often when you're on call, this is a true presenting complaint that I saw in the patient's notes. You're going to see things like this, and I didn't really know what to say other than advise them to drink Diet Coke instead next time.
A good dental intervention.
Yeah.
That's exactly what we're
holistic.
Diet Coke, bro.
So, other side of stuff they don't really talk about. There are many different things that are not necessarily medicine related that you can get involved in. So, if I go back one, leadership stuff. That's basically just trying to improve in any way your environment. So here's me. I set up a well-being board in the main entrance of my hospital that just displayed motivational quotes. You can get involved in teaching, and you can get involved in research. As a little pro tip, and I'll give you 2 for free, if you guys are struggling to find things to do on your CV, etc., definitely think about starting something in your school. So just to give you some ideas, what if you thought about starting up a science club? Something that started like you guys, your peers meet once a month to discuss some science topic. Or maybe not even that. What if you just discussed like how to tie a tie, or you taught juggling, for instance, and gave your peers an opportunity to present to each other? That shows tremendous leadership and initiative, which looks good for any application, regardless to whether or not you want to do medicine, dentistry, PA, you name it. That's good. Another thing to think about is maybe creating a buddy system. So that's good to show that you look out for others and you're showing empathy and support. And by that, I mean, for the incoming year 7s that are coming into your school, maybe pair them up with a year 9 or a 6th former who knows the ropes, just so they have someone to look out for them. If you were the person that was in charge or suggested that idea to your school board, not only would they support you, it shows tremendous qualities, which I'm sure many other people in your position haven't done yet. Just a thought.
We're going to see a scaring in schools now of everybody.
Yeah, everyone's yeah. So, Bill, I'll pretty much explain this. So I'm not really going to go into it too much, but graduate, foundation years, then very loosely you specialize. One thing that I may add is, fortunately, in the UK, you have an opportunity to pause, and you can do like pause years, or an F3 year, for instance. You can do this many times, where you take a year out to do other stuff. You can travel, you can teach, you name it. It is what you make of it. Over to you.
Okay, so gonna touch on what happens after you graduate. No, you don't treat sloths or animals. This was just a happy little camper that climbed on board while I was on the boat in the Amazon. We didn't actually treat him, we just rehoused him safely. But hey, I just thought, a bit of an interesting picture. You don't do that every day? Yeah, basically. For the ground.
Yeah, absolutely.
Right, so what happens after you graduate? Now, this slide is really, really simplified, and I've basically narrowed it down to the 2 main things that are going to happen to you. But essentially, you graduate, you do that extra year in training where you've already got your qualification, you can already treat patients, but you're kind of geared up to working and knowing the nuances of the NHS system. So you're a little bit supervised, but you're basically treating your own patients. After that, you have one of 2 main choices, either A, to become an associate or a GDP, or a dental core trainee. So basically what that is, you can probably think of a GDP as the GP equivalent of a medic. So they are the person you've probably experienced before. If you've gone to the dentist, they'll be an associate. They're your first port of call whenever you have a dental problem. Dental core trainees, however, they are dentists in hospital, and there's a wide variety of posts that they can do, but often if you go to a hospital for something, it's at a slightly higher level of care that is needed. Do a couple of years of DCT, and then you can go into specialty training. Now, there's all sorts of dental posts. The one that's probably most familiar to you guys is something called ortho. These are the people who put braces in your teeth and move them into the right position. Like that. So, couldn't get a picture for that because it's right here. Anyway, so what's life like as an associate? Well, like I said, you are the face of NHS dentistry. For your patient, you are the first person that they will see for this dental problem, and it's up to you whether or not you think, yeah, I can do this, this is in my own remit, or you're going to refer them on. And even within that, there's a lot of, I guess, randomness that comes with being a public-facing profession, the exact same you get with a doctor. I've seen it all from patients who may be having a little bit of a tough day, getting quite aggressive, to, I'm not sure if I told you this, actually, but I had a patient who came in to see me the other week, and she was just like, son, I'm really, really worried. Can I ask you this question? Bear in mind, immediately, I'm like, okay, what's going on here? And then she just asked me, son, I can't get my son to stop eating dog food. So, right. So, so you get the weird and wonderful things that necessarily...
You haven't told me that.
Yeah, no.
You tell me about boring teeth stories, and you
yeah.
Wow.
So, you are the face, as it were, as an associate. There's a lot less hierarchy than you get in hospital. So what that means is you are making the decisions for your patients, and there's a lot of freedom in that. You can decide what it is, and you feel really responsible for their care. Unlike when you're in hospital where there are lots of senior input, this is pretty much on you. The autonomy is pretty much there for you. Now, for those of you who didn't necessarily, your work experience fell through, unfortunately, because of COVID, I thought I'd talk about this really easy case here. So somebody came in to see me, weren't too happy with the gap in their teeth, thought it was like, oh, I don't really like the way I smile. So went through the option, decided to do a white filling. So it's a composite filling that you can add in to fill the gap. Really minimal. It's literally just adding it to those teeth. There's no drilling whatsoever. But while we're talking about aesthetics, he also said, you know what, maybe I could do with a little bit of a wider smile. So simple home whitening system for 2 weeks, got a little bit whiter, and then did the filling. The reason why you do it in that order is because fillings don't change color with whitening. So this is an example of you need to think about what the long-term plan is for your patients. But ultimately, really nice and easy case, really good result for the patient, and his confidence was back. And then finally, I know I touched on it a little parts, but you get a lot of flexibility as an associate. You're self-employed, so you pretty much set your diary how you want. You set the hours that you want to work by and large. So, for example, you could be that dentist who wants to work 4 days a week. You could also be that dentist like me who works 6 days a week. It's really up to you. Now, within this, I know I've painted somewhat of a rosy picture. There are some stress elements to it, as there are with any job. With here, particularly, you are the lead clinician, as it were. And if you think about it, you've just graduated, and now you are making these decisions for your patients. It can be quite stressful. The mouth is a very forgiving and yet also unforgiving place. The way that I think about it is, for example, if you took a piece of your hair out and you just put it in your mouth and you bit together, you would still feel that. You know exactly where it is. I wonder how many people actually try that now.
I'm trying it now right now.
And the reason why is your mouth is very sensitive, so you have a very small margin for error. It's actually better if you use your whole thumb.
Oh, really?
Yes,
I'll
actually
try that again.
Do that. There are also a lot of time pressures, and just to explain that for you, I will go on to this slide over here. And this is an example of a diary that somebody may have that I've had before. Usually I like to arrive, so if my first patient's in for 9, I'm going to come in at 8:30 and kind of prep the list. Discuss with my nurse what tools I'm going to need for specific things, just so we can be a bit more efficient. And then this will be your morning saga. So every single one of those is a new patient. And if you look at some of them, a totally new person, to get in and out of my chair, clean it, write my notes, and treat them, and diagnose them, and talk to them, to do that in 15 minutes, it's pretty rapid. And you won't be working this fast the minute you graduate. You can have a little bit more leeway with it. But after a few years, this is how your day's going to look. And if we do piece it apart, there is some variety in there. You're doing some fillings, taking out some teeth. But the way that I'd like to put it is, to be a dentist, you also need to be a really good actor. So, for example, if that extraction at 11:50, I'm overrunning, I'm sweating, it's a really difficult one to do, so much so that I'm thinking I'm going to skip the gym this evening.
Wow, you gym, bro? Wow, you just have to throw that in. You just have to, in this talk, you have to throw in that you gym.
Yeah,
wow.
Constant days. But you have to wipe that stress off and then greet your next patient at 12:20, even though you're running late.
Why do you say you need to be a good actor? Because what are you going to tell dog food lady?
Yeah, that's true. You have to be an
What
artist.
are you
You can't laugh, man. You can't laugh.
Fair.
You have to be professional. And then you have lunch. Very often it's not the hour. You probably have to be doing admin or letters or things like that. So you do get half an hour or so. And then finally your afternoon list. Like I said, you have flexibility here. So usually I don't like to book as many treatment stuff or as heavy treatment stuff because I fall asleep after lunch. And then 5 finish. Doesn't always happen at 5. Probably more often than the doctors get it. So there is that.
Shame on you.
So dental core training. So the way you can think about this, and there's a huge variety in these kinds of posts, but essentially you are a dentist in hospital. So I'll talk a bit about what I do as Max Facts, and that's anything to do with the head and neck. So I deal with head and neck cancer cases, trauma, salivary gland swelling, so weird swellings that come in and out of your mouth, the weird and the wonderful. And in effect, it's kind of a weird thing because you are kind of like an F1. You still have a ward round, you create a list of jobs just as Nav was taking it. In effect, the only thing that has changed you is the training that I got to do this was 2 days. So it took me 2 days to become an F1, and it took you 5 years.
Wow, so, that's funny. This guy, right? On his first week, he calls me being like, "Bro, what's ECG, man? No, what is the leads, man? Like, you think you could do what I do? Yeah, you probably.
Yeah. So. Yeah, in the flip side to associate life, though, you get the hierarchy. So now you have lots of senior support. You have consultants and regs and all that malarkey, and you don't really get the autonomy that you once had as an associate. However, the flip side of that is you really get to develop some extra skills you didn't think you would as a dentist. So here's me outside Great Ormond Street when I was on this rotation, and one of the things that I never ever thought I'd be doing in dental school was a procedure where I had to take bone out the hip in order to replace a defect in someone's cleft palate in their mouth. Now, if you told me I was going to be doing that at dental school, I think you'd be having a laugh because I am so far south of where I've been trained to do, but it's just an example of the things you can get involved in when you go to hospital. However, like I said, there are negatives in the fact that you get a little bit less autonomy here because you're from being at the top of the food chain, from making the decisions for your patients, you're now right at the bottom, right next to the rats. It is challenging, though, to come straight onto the ward where you aren't necessarily as best prepared. I remember one of my first days where one of the nurses came up and was like, "Oh, doctor, can you prescribe some fluids?" And I was like, "Water? Can we get some water?" So we sell for Hartman's in the end.
By the way, by fluids, he means like intravenous IV stuff.
Yeah.
It took me 5 years.
2 days. 2 days.
Wisdom.
Yeah. Anyway, so this final slide, I know Bill talked about the infinite number of things that you can do in medicine. The exact same thing in dentistry. And with the flexibility of it, you can really make it your own. You could work a couple days in practice, a couple days in hospital, 1 day teaching. It's really up to you. So to just talk a bit about those pictures there, that's me and Nav doing some outreach and delivering some toothbrushes and toothpaste.
Yeah.
That one at the top is us providing care for the homeless in the back of the van. And at the bottom is just some stuff that you may get involved with the Army Reserves. But there is honestly so much in here. It's not always dental. Some of it is running the business of practices. Some people just retire from clinical dentistry and they run more than one practice. It's really up to you.
I'd like to point out that when we were delivering toothbrushes, our catchphrase was, "We are fighting enamel cruelty."
Make that t-shirt?
Right?
Okay.
It's funny stuff.
All right.
We're done.
Roughly, yeah.
So, we're probably over time, and Baxter's probably sweating profusely and is going to be really angry. So I'm going to quickly just use this time.
I don't know what you guys saying about that. No, I'm definitely not. I'm having a bit of a laugh, to be honest.
Of course, he has to come online for this.
Yeah, of course.
All the hair jokes, he has to come online for this.
This stuff I'm going to come online for. But no, honestly, guys, that's amazing so far. Carry on. Don't worry about time. We're doing well. Okay, go for it.
I know. You kids are sorry, I see your parents again. We're going to stay here all night, 24/7. No.
So, all right, jokes aside, I thought I would just spend a couple minutes just talking about well-being, simply because all of you guys who are watching this are probably going through one of the most stressful times of your life, and it's really important to know that you're going to be putting a lot of stress and extra pressure on both yourself, you're going to be getting that from your family, and you're going to be getting it from your friends. So if you don't take care of this as well, these... True. Well, basically what I'm saying is we've just got to do a stock check, okay? So I'm just going to share with you a couple quotes from my whiteboard that might be useful to reflect on. I think the first one is I'm basically trying to say no matter what the odds against you are, no matter how difficult it may seem, you're never gonna know unless you try. Okay, no matter what people are telling you, you have to give it a shot. If you really believe in this and you really believe in yourself, what's the harm in trying? In Newcastle, they used to say "shy bairns getting out," which basically means that is English, by the way. Children won't get anything unless they ask for it, and the worst they can say is no. More on that later. Can I just say on the whole, don't be afraid to try. Is that the moon? It looks like a little biscuit.
What do you mean? Of course
So
it's the moon.
everybody, clearly don't be afraid to try, because if you want to put this in the public for your whole hospital to know, this is how good I feel.
You get a whiteboard, Ben?
Literally
I
never
see
be
your
on my
whiteboard.
charades dictionary. That is
I'm talking about well-being. I said no jokes.
Yeah, no, brilliant. Wow, no manual dexterity. You were terrible. Anyway, slide 2. So the second thing that I wanted to say is that no matter which way you cut this cheese, whatever you want to call it, it's going to suck, okay? But you have to ask yourself, what if everything that you're going through right now is preparing you for what you've asked for? And by that, I mean, if, say, for instance, medicine or dentistry or PA-ism is your goal, if it came to you easy and you're going to have difficult days when you have your job, you might not feel really motivated to go through it and carry on. But if you had to work hard for this, if you really had to strive for this, you built your character, you built your motivation, that'll give you much more needed reason to carry on in those dark days, which will always happen, no matter how hard you try them not to. Third one, a lot of this stuff, unfortunately, no matter how skilled you are, involves a lot of luck, okay? A lot of variables that you can't control. So what I'm trying to say here is that just try and focus on the things you can actually have an influence on. All that extra added stuff that you can't control, even though it's really easier said than done, try not to worry about it, okay? Just turn up on the day, do what you can, give it your best shot, and at least you can walk away from that situation with your head held high and say, I couldn't have given that any more, all right?
It's the same attitude. Oh, sorry to touch on that. It's the same attitude I had for my exams. Like, it's so stressful, but when I walked away, I was like, you know what? That's the best I could do. I couldn't ask for anything more. Park it there.
Yeah. This one, and this is the one that I will end on, is I'm basically just saying the time it takes to get to where you want to be is irrelevant. And the reasons for that, well, I'm going to hand over to Son, because I think his story is somewhat relevant to this quote more than what I have to say.
So for me, the reason why I'm saying that is I didn't get into dentistry first time around. I was like, you know what? I know this is what I want to do. I just have to prove it. So I took a gap year. This guy took it with me just because, just for Jays. But what I'm trying to say is just because you don't get in first time, that doesn't mean that doesn't mean it's over. You need to remember that the thing you're about to embark on is not a sprint, it's a marathon. If you get into medicine and dentistry, you're going to be doing this thing for 40, 50 odd years. So what's 1 year? What's a couple of years for the rest of your life? And the way that you have to think about it is, yeah, you get that knock, but in my experience, all the best clinicians, medicine, dentists, PA, whatever it is, they're all the people who have had to deal with some sort of adversity. So if for you that knock comes in GCSE and you didn't get the grades you want, or it was A-level, or you got rejected from all dental schools like I did, or actually maybe it happens after you graduate and then you fail an exam and you might also be kicked out of uni. All of those people had to deal with that knock at some point. And those are the people who almost lost it, who fight so much more and who are so much more appreciative of the long, hard slog and how lucky it is that we are here. And they, in my mind, make the best clinicians. Even the big man himself, the reason we are all here, Factor, also took a gap year with us. So as humans, we all make mistakes, and to human is to err. So don't take it to heart if not everything goes the right way as you intended. For me, I used to sit on the panel at King's and used to do it at Newcastle too. Yeah.
And by and large, I don't want you to ever think that we're out to get you as an examiner. What I am trying to do is, when you walk into me, when you walk into that room, when you walk into that room, I'm just thinking, does this person, do I think they are going to enjoy dentistry? Do I think they're going to make a good dentist? And that's what I'm doing. I'm actually on your side. And if I think at the time, no, I don't think they do, maybe I'm going to say no today. But hey, if they came back a year later and gave me a slightly different performance and sold it to me, maybe I'll change my mind. I think to say that invigilators on your side is basically just to say that at that moment, to do any of these courses of the people that I've taught requires some level of emotional maturity that you may not have developed yet. And that's understandable, seeing as the only thing that we really do in the UK is you just go through school, and then a lot of people just go straight to uni. You don't really have a chance to actually like live life and understand that there's so much more to it. But yeah, I think now we're probably going to go and ramble a bit more.
Yeah.
But I hope some of that was relevant. First off, thanks for listening. Obviously, let back to know if you have any questions. We'll do that in the Q&A. The only quick thing that I wanted to say, though, as much as you might give kudos to any of the people that are speaking here and giving their evenings, pretty much 100% of it should be directed to Baka, because he has spent many, many evenings planning this, and whatever it's just incredible that he's done this for free, pulled all of us together, got you guys here.
I think there's at least 2 people watching this stream right now.
Yeah,
at least
one.
We're just, it's, yeah. So, Yep.
Anyway, we're going to stop talking now. So, thank you
Guys,
very much.
thank you so much for such an informative, but also just a fun talk. I was just cracking up. Probably everyone. 392, by the way. You know, that's how many are still here. Not one. Still watching and having a great time. So yeah, thank you very much. But I think what I will do, like I said, some people have been sending in some burning questions. A lot of the questions I'm saving for the end. Honestly, I've just there's 300 plus questions I've got right now, so we won't be able to obviously go through all of them. There's one main one a lot of people have been asking over and over again, lots of different people. Son, is for you. I think people want to know why you sorry now, mate. We're doctors. We're gonna just get out the screen, right? But yeah,
it's a song out and now.
Son,
Get
it's for
out of
you,
here.
right?
Hello,
So
yes.
a lot
What
of
is
people
the
want to know
question,
why you personally wanted to do dentistry. And also, I think it's interesting because you guys are twins, right? I mean, I study with you guys in school. We go together. These guys do everything together. So why did you kind of part ways? I mean, thank God for your patience, because the way you guys can tell, these guys are like, they're crazy when they're together. But yeah, why did you decide to do dentistry?
So, and this is where I think it slightly comes down to luck in a way. I remember I was one of those guys where I didn't really think about what I want to do. I was just like, yeah, I'll be a pediatrician ever since I was like 8, probably because it was the biggest word that I knew, and I just regurgitated it verbatim, not because I knew what it involved. And then it was a comment one of my cousins made when I think I was 15 or 16, because we wanted to go to the same uni, and he's like, oh, you guys...
we both wanted to do medicine.
Oh, yeah, we both wanted to do medicine. And then he said, oh, you guys both want to do medicine. That might be tough. You're going to have to really make your personal statement to look quite different. No uni wants to accept the same candidate. Now, in retrospect, in hindsight, I know that's actually wrong, because there's no university in the world that can look to that level of minutiae to separate candidates. And I know twins in the same year doing the same thing. But that comment was the first thing that sparked in my mind, why do I want to do medicine? I haven't even considered anything else. And then I boiled down what I wanted out of the career to see 3 simple things. I wanted to deal with people. So, whether that's a team, whether that's patients, I just wanted to be around people. 2, I wanted to work with my hands. And then 3, I just wanted something to do with science. So if I applied that criteria into medicine, I realized that if I had to work with my hands, I needed to be a surgeon. And if I wanted to be a surgeon, well, most of the people I deal with, they're in my team, but they're not really patients, as it were. Like, if you do your job right as a surgeon, by and large, they leave. And most of the time you spend with them, they're asleep under the table, you would hope, right? But when I did my dental work experience, I saw these clinicians who had been treating the same people for like 20, 30 years, developing a really good connection with them, understanding their jobs, their kids. And there was this one moment I remember where this dentist, he recalls this patient every year, and every year this patient comes in, she brings him a chicken casserole. And I love food. And I was just like, at what point do you get to the relationship with somebody that they just give you a chicken casserole every single time they come in? And that kind of bond you can get, like, it's like the patients you treat are your extended family. I wanted that. And then there was so much after I realized in my dental work experience that you didn't really get with medicine, because, you were a leader from off the back. You set the plan for your patients. You get to do it, and you get to see the results by and large almost instantly. You get to follow up the same patients. It was just the best jack of all trades. And ever since I'm in, I've never looked back.
Yeah.
Awesome.
I'd also think I'd like to point out, one of the reasons why Son didn't get in first time was basically because literally, I would say, 4 days before we sent off our applications, he switched from medicine to dentistry, knowing that it was going to be harder, knowing that he might not get in. But overall, in the end, like we were saying before, time is irrelevant if you took the time to find out what you actually want to do. And that's exactly what he did. And I don't think any of us look back to making
And
Yeah,
how much
different
better,
decisions.
or how much of a better dentist are you today because of that particular decision? I mean, coming back to the well-being thing you were talking about now as well, it makes a huge difference. The kind of things you can learn. I mean, I'm going to talk about it later as well, my personal experiences. But I know you guys did some amazing work in America as well during your gap year, didn't you? So why don't you just spend another 2 minutes just talking about that?
Yeah, so to be honest, if I had to roll the dice and go all over again, and let's say I got into dentistry first time around, I would still take a gap year. It was, without a doubt, one of the best years of my life. And the contingent I'd give with that is you should try and do something with it, because I spent the majority of it trying to get into dental school. But once you got that and you had this kind of 6 months, few months of, you know, you're going to uni, you don't really have to get a job, or maybe you're saving up, you can basically go traveling. I guarantee you, most of it, by and large, you're not going to get that. You're not going to get the thing where you can do absolutely nothing for 3 months and still go somewhere at the end of it. It's absolutely liberating. So what we did was we went to Camp America, worked in a special needs camp, and thought, I know looking at the slide, it might look like we've done lots in uni and stuff like that, but honestly, before uni, we were the guys that did nothing. We'd turn up, maybe we'd do a biology seminar. I remember a couple times for all three of us actually to try and pad out our personal statement. We'd be like, there's a lecture at UCL. Let's go into London. And obviously we'd never really taken the tube into central London before. We came so late. We just got to the
entire lecture,
at
didn't
the
we?
end of the lecture. Didn't even see the lecture.
Yeah, really presenting it well.
Oh, yeah, sorry. Yeah, no. Do come to the lecture on time. Yep. But basically what I'm trying to say is when you see things like this, you see these people who have made it, you think that, oh man, they've been doing it right since day. But actually, they really haven't. They've just been the same people as you, the same fallible people as you, making it up as they go along, by and large. So,
a lot of luck is involved. So we had a lot of wake-up calls. You guys won't have this, but we had modules when we did our sixth form results, and we got results in January. We didn't do well. I remember my chemistry teacher saying, I'm not going to give you predicted 3 A's unless you really pull your socks up. If I hadn't got that wake-up call and worked really hard, then I wouldn't have been able to meet that criteria. I guess that's a tangent. But I was going to say, that gap year, interesting that you say you would have taken it even if you got the offer. That gap year is basically what kind of, it showed you what not doing anything is like. And so when we both went to uni, we were like, we know what a chilled life is like. We kind of know there was like a period of a few months where we didn't really have much of a purpose. And I'm not saying medicine, dentistry, PA gives you a purpose, but I'm just saying having that life experience kind of showed us that trying to be motivated to do something is really important. We only got that through our gap year. The first time we were working with people of different backgrounds, races, ethnicities, was by working during our gap year. So you develop all of those soft skills, which help you in an interview, but also just generally in life, in preparation for uni, just by having the time out of school to develop those skills. So I would recommend a gap year to anyone.
And also, just honestly, just get a job. For some people who graduated dental school at the age of 25, they had never had a job. Dentistry is their first job.
It teaches you so many skills, doesn't it?
Yeah,
it teaches, like I was just asking you, it just teaches you so much different stuff, and again, the kind of things you can pick up and take with you to your careers afterwards as well makes a huge difference. So I like you guys said as well, it's honestly not the end of the world, as Nav was saying, well-being being one of the most important things. So give it your best shot. If it doesn't happen, at least you've got no regrets, and you can just give it another shot later when you're a better person. If you still want it that bad, right? Would you guys agree?
I know one guy who got into med school on his 7th attempt.
He must be.
Not that you need
to
but I'm just saying.
7.
Yeah. Life expectancy for a male is about 80 odd years. You're gonna have plenty of time.
Yeah, and females live even longer. They live even longer, so you guys have got even more time. But thank you very much, guys. Honestly, that was an amazing talk.
No problem.
I'm sure all the dental participants had an amazing stuff to learn, and also even the prospective medical students, you guys have had so much stuff to take away.
Just out of interest, if I converted some of you to the dental side, just let me know, because I keep a tally of you on my wall. Great.
How many? So both these guys, they said that they sit in, they have sat in panels before. These guys both obviously participate in the MMI courses, which I'll be telling you guys about later on anyway. But yeah, thank you guys, and again, awesome presentation. So I'll see you guys later. What we're going to do next, guys? Thank you. Yeah. Guys, what we're going to do next is we are now going to go over to Ailey's presentation. So Ailey is a graduate entry medical student at Newcastle University. So what I'm going to do is I'm just going to bring up her presentation. and I'm going to play it for you guys because Ailey recorded it previously, just to make things a bit easier. As we've seen, technical issues can be really annoying. So I'm just going to put that up. In the meantime, again, don't worry if you're putting in questions. Honestly, I'm not ignoring the questions. I'm just asking the ones that a lot of people have been asking, and then the Q&A at the end will cover everything else. So just bear with me a second whilst we bring up Ailey's presentation. Okay, so let's watch Ailey's presentation.
So my name's Ailey, but some of you might also know me as the graduate medic. I'm an accelerated or graduate student at Newcastle, and I'm just leaving my first year of graduate entry at the moment, technically today, which is exciting. I'm going to start off by talking about what graduate medicine is, for those of you that don't know, or you might have heard different things. So it's a 4-year course. Some people call it A101, some people call it A102, some people call it JEP, but it all is tied in by the same thing. It's for graduates only, it's an undergraduate course for graduates, and it's always 4 years long. The different courses have slightly different structures amongst them, but they all suit the same criteria. I know some of the undergraduates here might be thinking it doesn't matter, but the truth is that things go wrong. I was an A-level student who really wanted to do medicine, and I suppose life just got on top of me, and I ended up going to do my tropical disease degree instead. And actually for me that was the perfect, most appropriate thing to do. Or some of you might not get your grades. I know the pandemic is hitting some people really hard. So I suppose the point is 3As are hard to get. A 2-1 is most people get a 2-1. Most people don't get 3As. So if you find yourself in any reason in a position where you want to do another degree first, this could be really relevant to you. So just try and take, I suppose, a note away that doing a degree first could be an excellent opportunity for you. So I suppose the kind of main thing I want to talk about is my bugbears with people applying to medicine. I think the biggest thing is that people think that if they have a really good application in one area, say they've got amazing work experience, they'll think that it makes up for not having quite a good application in another area. So I know people that apply to universities that don't accept 2-2s, but they've been a nurse, and that's amazing. They've got amazing experience, but you need to apply strategically. I think there's this kind of common misconception that someone looks at your application as a whole. That is, the only universities that do that are kind of maybe Oxford and King's, but generally it's a tick box exercise. So something like Birmingham, they'll go, does this person have a first or a second? Well, firstly, they'll go, does this person meet their entry requirements? They'll go, yes, and they'll move to kind of the next pile, and then they'll start pitting and seeing who they should select for. Among those who have got the entry requirements, how do they then narrow that list down? And different universities do it in different ways. And if you don't play to the way that they do it, it's too late. Your first doesn't matter if they're looking for a high UCAT score. At Newcastle, you might get an 81% in your degree. You are pitted no differently against someone that has 61% because they prefer the UCAT. So if you don't have a good enough UCAT, despite meeting the entry criteria, it just doesn't make the difference that I think people hope that it would make. And the reason I'm kind of laying into academics the most there is that academics aren't as important as people make you think. You don't need to be an academic to be a good doctor. Actually, all universities look for work experience during interview. Only about 3 or 4 universities prefer a first to a 2-1. The others just rank them kind of equally. So if you're in your third year and you're thinking, how should I manage my time? I would say the best way to manage your time is actually focusing on getting work experience. Be sure that you want to do medicine. Get the experience so that you can show someone at an interview, look, I've worked hard and I've got a good degree, I've got a 2-1, but also I know loads about what medicine's about. I've put all of my effort in, I've built some resilience, and that's far more valuable in most universities than just having a first. And I think the same thing kind of applies to personal statements. The majority of them, I hate to say, don't read them. Warwick, for example, they don't read them at all. Newcastle will basically check for red flags, which is they'll check to see if you've said something disgraceful, but generally it's not a ranking criteria. So I suppose just be a bit careful with stressing about personal statements when you could be using that energy elsewhere. Just check for anywhere that you apply, how they select, and whether they look at your personal statement or whether they look at your reference, because they're all really important things. So I know that was a bit of a rant, and the rant doesn't stop there, unfortunately. I'm actually going to talk now about why people think undergraduate medicine is less competitive, but it's not. You can have universities like Warwick, they have the same amount of offers per person, if not more offers per person, than the standard undergraduate course. So actually it's about applying strategically rather than undergraduate medicine. And I want to show this with an example. So we've got kind of the dream candidate, if you like. They've got all A's, they've got subjects that open more doors to the most universities, they've got a chemistry A level, they've got a bioscience degree. They can pretty much apply anywhere. They've got widening participation criteria, which is important, as we'll come on to. They've even got an over-average UCAT score, but for graduates we'll learn that this isn't an over-average UCAT score, and it's not actually as competitive as you might think. So this student's gone, I think undergraduate's easier to get into, so I'm going to apply to undergraduate courses. I meet all the entry criteria of the universities I'm applying to, and they think, well, I've got a first, I've got a good chance. So what actually ends up happening is they get 4 rejections, which is completely unexpected to them. And that's because this student didn't play to their strengths. They've got an entry exam score that was competitive for some undergraduate universities, but not really. And what I want to make the point of is, you've got universities like Southampton, and they'll say, right, we've got 100, it will be less than that, we've got 100 graduates that have applied to this course. Let's not rank their UCAT scores with the A-level students, let's actually rank them separately. So the cut-off for the graduates applying to the undergraduate school, the undergraduate course, ends up being higher than it is for the undergraduates applying to the undergraduate course. So people will look up the cut-off for Southampton undergraduates and think that applies to them, but it doesn't. Not all universities do this, but a good amount do, and it's just not recognised well enough. So you need to be a bit careful. But, so this student, they've got the exact same stats, they apply again, they get the exact same UCAT score, but this time they've applied to 4 graduate medicine courses. So actually they've been much more smart here. Warwick do select using UCAT criteria, but they also select using work experience, which the student has. And because it's a bigger school, there's more places per person. Their UCAT is actually competitive enough. A similar rule applies to Sheffield. Sheffield have tight widening participation criteria. Not many students meet it, but this student does. And actually, Sheffield have interviewed anyone that has met their criteria, as long as, regardless of their UCAT score. So the students applied there as well. And then we also need to remember this student has an excellent academic profile. So for Birmingham, they kind of lean towards academic students. So this person actually gets maximum points in all of the academic criteria kind of selection, because with Birmingham, they assign points to each candidate. So that's an excellent choice as well. With King's, they tend to value kind of all-roundedness. They like candidates that have a bit of everything. And this candidate actually does. His UCAT score's not amazing, but this other stuff has made up for it. So these are much smarter choices. I'm hoping this conveys that undergraduate is not necessarily easier. You can apply kind of strategically and be in with much better chances. You can apply to a university with loads of places per person, but if your portfolio doesn't match the things that they want, it's completely irrelevant. But if you applied elsewhere, you could have every chance of getting in. So just don't waste those choices. I'm now going to go through tuition fees for graduates, and I'm really sorry this is going to be really quick, but for graduates on the graduate course, you'll pay £3,465 towards your first year. Student loan company will make up the rest of the fees. Then from second year onwards, the NHS covers the first £3,465 and student loan will cover the rest. Compare that to the undergraduate course, you won't be eligible for student loans for tuition. People will tell you that you will, you won't. It's a horrible fact, but it's a fact. You'll need to self-fund the money up until fourth year, the whole £9,250, and then you'll get a bursary for the full amount in fifth year. So I suppose the main difference is that the NHS bursary isn't very significant between the two. It's about £1,000 difference. But what is significant is whether you get a loan or self-fund. If you've got a lot of disposable income, you might think, oh, I'll self-fund, I won't get the interest. But if you paid for your last degree, if you got a loan for your last degree, and you started university after 2012, so you have those higher fees, you're actually this is really depressing, I'm sorry, but you're in so much debt by that point that with average salary progression, by the time you get the interest that you have had by going through medical school and you graduate, then you will not be paying for the rest of your career, your interest will always be higher than you're paying back, no matter how much you earn, because the amount of time it takes you to get to that point, you're just not making a dent in it. So just consider that when you're wondering what to do, I suppose. And I think that kind of leads nicely onto maintenance costs. So the A101 students, the graduate students, you'll get a full loan for the first year. So I got over £10,000 this year. I'm not going to go into detail now. If you want to ask me how, I can tell you. It's not shady at all. Just send me a message and it will be very obtainable for most of you. And then, so I've just now applied for the NHS bursary. And what you get is you get a maximum of £6,000 between all different types of funding. So you could have £0 income for your family and you'll only get £6,000. It's not a lot of money, and it's made up by a combined reduced loan, a non-means tested bursary of £1,000, and a means tested bursary maximum. So yeah, it's not a lot of money. If you're 25 or over, you do not qualify for bursary purposes to be independent. You have to prove that you've had 3 years off. It's quite complicated. It's not the same as student loan. So expect to not get very much money. It's actually even further reduced by £500 in your fourth year because it doesn't count as a full year. So you get less money from the student loan portion. If you compare that to the A100 students, they're eligible for the maintenance loan, the full maintenance loan up until fifth year. And then in fifth year, they'll get the reduced bursary amount that the graduates get in fourth year. Some use the maintenance towards their fees. It's up to you how you want to do it if you go down that route. But obviously you will need something to live off, so it's quite difficult. Here's the next relevant bit of people's application I want to talk about, is their work experience. So I'm going to go through this quickly again, but don't stress about getting loads of medical work experience unless you're planning to apply to Nottingham or Warwick. They want specific hands-on care, and if you really want to get hands-on care, and actually what I would say, I'd probably recommend this to anyone, is being a bank healthcare assistant. You learn loads about how a medical team works, and you essentially work as think like a supply teacher, but as a healthcare assistant. So you go onto different wards every day. There's that versatility. You work with lots of different staff. So it's a really good learning opportunity, and I really recommend it. You can, if you work on the staff bank, you work when you want to work, so you can juggle that with your third year as well, if that's the situation you're in. Shadowing is good. It's relatively inconsequential to most interviews. It's good for showing that you've got an insight into medicine. It's not good for showing resilience, for showing teamwork, and all of those other things. So get maybe a week, get what you need to fulfill Warwick's criteria, for instance, but don't go and get loads of it for your application because it's relatively pointless. Well, it's pointless to get more than a certain amount, so just be a bit careful with it. What I would actually recommend instead is, if you're a university student, I did something called Nightline. So it was a really good experience. I think about it like the Samaritans, but run by students for students. So I sat from 8 p.m, 8 a.m, maybe 1 or 2 times a week, and I gave advice or I listened to people. And actually it showed a good amount of teamwork. I learned about confidentiality, when I could break it, when I couldn't. I talked to people, and it's really well recognised actually in interviews. So if that's something you're interested in, then definitely give that a look. If you're not interested in it, any work or job that you've had, any society that you've been in, it shows that you can do the same teamwork, that you have resilience. So don't just write them off as pointless experiences, because at graduate entry, they know people come from different backgrounds. And having that, oh, I didn't just go to university and study, having, oh, I did this and I did this, it shows you're more of a well-rounded person. And actually, you might be able to understand patients better. So consider, like I've said, not smashing that academic portfolio, but actually just having a bit of experience. You know, I worked in Tesco's, and even that was beneficial. It's just about having things that you can reflect on, and it's about how you reflect on it. So tailor what you need to do, I suppose, to the university you want to apply to. Just don't get too bogged down in being a healthcare assistant, for instance, unless you're applying to a university like Warwick. I think the final thing people talk about is my graduate medicine experience. And it's kind of the trickiest thing to talk about, because I think I'm just going to rain on everyone's parade. What I'm about to say won't apply to all courses. Newcastle do 2 years in one. It's one of the more intense courses, if you like. So I had to learn really quickly about how I learn. I did my degree fairly comfortably, but actually the techniques just I didn't have time for those techniques to work for graduate medicine. Had to learn how to use Anki. I had to tell myself to stop writing notes. Writing notes works really well for me, but it takes a long time. And you have to stop thinking about quality and start thinking about quantity with medicine. It's about strategically, it's horrible to say, but it's about strategically studying and just learning what you have to learn to the level that you have to learn it. You do not have time to learn more detail. Sometimes you don't even have to have time to learn all the detail you need to know. I suppose someone on my course described it as taking a sip of water from a fire hydrant, and that is definitely how I would explain it. I suppose you just have to keep your head above the water. You'll get sometimes given way too much than you can handle, and you've just got to remember that no one does everything. We've all had to skip parts. You know, at one point this year, we were given 150 learning outcomes to do within 2 weeks. One learning outcome was as broad as describe the menstrual cycle, and then we had an exam straight after it, and 25% of my course failed. And I know that sounds absolutely daunting, but the important thing there is to support one another. When you get to graduate medicine, I'm really sorry to say, but you are going to burn out. You are going to feel like you've gone from being the smartest to the dumbest, or whatever way you want to put it. So just be prepared for that, because I feel it every day, and even the people that do best in the year feel it every day. If you don't have a support network, you are going to make yourself either mentally or physically ill. I know that sounds absolutely melodramatic, but people told me that and didn't believe them until I just got a bit through the year and thought, God, I need help. You have to support each other academically as well. You do not have time to do all the resources yourself. With those 150 learning outcomes, actually it was way better to split them up between 5 people, give them 25 each, or however many each, and then say, well, let's give each other the resources so we don't all have to spend time researching. It's very self-led. You're not going to be spoon-fed anything. It's actually, you just got to be very independent. And I know that sounds absolutely awful, and I've just slated it horribly, but at the same time, you will feel an incredible sense of pride. You will adapt your learning skills. You'll be a better student. You get through that one intense year, and you'll be much better than your undergraduate peers at studying, knowing how to study, knowing how to work as a team. Things like diagnostics, graduate medics tend to be much better at, because they've got a better grasp of things. And then obviously the clear advantage is that you'll be a doctor sooner, and it's cheaper than the undergraduate course. So it's really good. I've loved it, but I've hated it in equal measures. It's high highs and low lows. Just prepare yourself for that, because I know it's the dream that everyone wants. But sometimes you'll get there and be like, why have I done this? And I thought I would never feel like that, but I do. It's normal, everyone feels like it, and I just wanted to prepare you guys for it. But I suppose we should get on to something a bit more relevant to you guys right now, which is some questions that I'm being asked all the time. So, how will things change with COVID? I can't give a definitive answer, because I don't know how COVID is going to change. What I can, if there's a second peak, for instance, your interviews could well be online. I have no idea what's going to happen. What I can tell you is that Warwick have changed their work experience. They're now including roles such as 111. If you don't know about Warwick, I don't have time to go into it, but go and look up their specifications for what you need work experience-wise. The other thing that's changed is the GAMSAT and the UCAT. So they're both online now. The GAMSAT only for the last sitting that's just been. For the UCAT, it doesn't mean too much because everyone's on a level footing, everyone's sitting it online. For the GAMSAT, you've got 4 sets of examinations, so 2 per year that are eligible to be applied with for each application cycle. So the curve was released today. It's shifted to the right, which means that generally people have done much better than they would usually in an exam. I don't know if that's going to translate into increasing cut-offs. The reason that I don't know is because we don't know whether the other application or the other examinations might drag that effect down, but I wouldn't be surprised if they did increase. So if you're a bit of a borderline candidate, be a bit careful when you're applying strategically. How to balance your third year UCAT and GAMSAT. The advice that I give for this one is a bit rubbish. Don't if you don't need to. Look at the entry requirements, narrow down where you can apply to. If you can't apply to somewhere, there's no point doing the GAMSAT. So look where you can apply to, and then look at the statistics for the selection criteria and how they decide. And you might find that you have the entry requirements, but actually they look at A levels when they're selecting, like Birmingham, and your A levels aren't great, so you would tick that one off and just say no. So if you've got like one GAMSAT option, for instance, I would maybe say think about maybe not doing the GAMSAT. It might not be worth it, but it's all dependent on your application, how well you work, and what exams, whether you can study 3 exams at once. Because you've got the GAMSAT, you'll have your third year, and you'll have the UCAT. One way around it is do the GAMSAT in March, do the UCAT in September. It's very hard to juggle both if you do them both in September. It's absolutely possible, but just be mindful that it might impede on one of your scores. And then finally, what my stats are like. I get asked this a lot too, and I suppose the reason I'm going to talk about it is because I really want to just say academics aren't everything. So I got an ABC in philosophy, biology, chemistry. I got a 2-1 in tropical diseases. I got 750 in the UCAT. I got 61 in the GAMSAT. I applied first time, got in at 2 universities and had 2 interviews. But I realised I just didn't apply strategically, and I applied not to places that I wanted. So I ended up applying again, and I got, this time round, 4 interview invites. And over both cycles, I ended up attending 4 interviews and got 4 offers. So actually, all you need is that 1 interview, and you can get the offer, and you'll be fine. Don't stress too much. If you've got to the interview stage, like I say, I've been to a few graduate ones, so if you want any general pointers, then of course you can ask and just message me. Which leads me on to the point that if you've got any questions at all, just let me know and just get in contact.
Right, guys, an amazing talk by Ailey. Thank you very much for that. I think it's been super useful, not just for the graduate students, but to be honest, for normal undergraduate entry medicine as well. I think it makes a huge difference in terms of the kind of things you need to be aware of, funding and all of that, and you broke that down really well. So thank you very much for that. What we're going to do next, guys, is finally finish off. I know it's becoming quite a long event with some of the glitches earlier, but we've managed to get past that quite nicely. We're going to finish off with a little talk from myself. So I'm going to give you guys a bit of a tutorial on kind of things I've been through, what I've done so far, and also then go on to now the more important parts of your application. Some of them are going to be applying, also the UCAT, and then we'll go on to the Q&A. I'm just going to fix a few things up before we get going, really. Okay. So let me just bring up my presentation, and once we've got that running, I will talk you guys through it. In the meantime, just to remind you again, if you have any questions, you can post those on the Instagram live that I put up. just before we started, and then we will go through the Q&A right after my talk. It shouldn't take any more than 10 minutes. It's a super quick one. And then we will finish off after that and give you guys your certificates and get some feedback of you guys. All right. So here we go. I'm being very careful with this stuff. I don't want to press the wrong buttons and get rid of everything. Okay. One thing I do want you guys to just be aware of is, if they're in terms of what your UCAT prep's like. So hopefully, what I'm hoping is that most of you guys have already booked your exams. If you haven't booked them, I would suggest that's one of the first things you do after this event is over, just so you're able to just so you have a testing slot and date for that. For some reason, just bear with me one more second. I'm just gonna get my full presentation up. It's cutting the screen, which I don't like. Also, good little drinks break or something like that if you guys would like that too. Aha, there we go. Perfect. That's exactly what I wanted. And we will get started. So you'll see, obviously, let me just explain. So at the bottom there, you can see the guys and myself. So Son and Nav also. So what I'm going to do is briefly just talk you through a bit of a timeline that I have gone through really to get to where I am today. So the picture on the left, perfect, that's exactly what I wanted. So the picture on the left is me in school, probably at the stage that you guys are at right now, kind of just dealing with UCAT, BMAT, personal statements, and all sorts of those things. So this was sixth form last day, and if you look closely, that's me and Son and Nav at the bottom. You know what? So when I first met these guys, they obviously, as Son was saying, he only changed his mind quite close to the application deadline that he wanted to do dentistry. Initially, being in that competitive zone and even the stage that you guys are at, it's very easy to get in this kind of mode where you think you're fighting everyone else for your place. What you actually should be doing is, especially with your friends, is getting together, working as a team, kind of helping each other out. And you'll see that you'll just get further that way. At the end of the day, medicine is all about teamwork. Right, and then the picture on the right was 7 years later, 7 long, hard years later. A lot of fun is when I graduated. That was last summer, and the building behind is St. Paul's Cathedral in London, and the ceremony took place in there, and it was absolutely incredible. So the timeline I've done, unlike what most people would do, is I'm going to go backwards, right? So rather than saying this is what I did first, I'm going to talk to you guys about what kind of stuff I did and going backwards. So going from graduation back, right? So one of the things I did last April is set up the Medic Life. Now, the reason I wanted to do that is I used to work for quite a large organization. Again, I'll talk to you guys a bit more about that, teaching UCAT, MMI courses, BMAT all over the country. And one thing I didn't quite like is the fact that a lot of people, a lot of companies out there were charging a lot of money for services that I think were putting at disadvantage students from low-income backgrounds, which is kind of what I was like when I was at your stage, and I know there's tons of people out there with the same issue. And there weren't any good resources which were affordable. So I set up the Medic Life to do just that. And one of the reasons why you guys are here today for the live free work experience workshop is because I wanted you guys to get information that is not so readily available, but from experts. It's very difficult nowadays to find resources which are A, affordable or free, and 2, from experts. Normally what happens is sometimes you get free information and things like that, often from people who may not be experts. In this talk you've had today, I made sure I gathered people from different roles. For example, Ailey, she's done tons of work with graduate entry medicine. She is developing even more stuff that she's going to tell you guys about later. Neely, again, has done so much stuff with the physician associate department. Bilal, Son and Nav, especially Son, he does so much stuff within dentistry. He sat in panels, he comes along, he's our lead dentist person to basically advise the Medic Life and any events we do when it comes to dentistry. So yeah, so wanted to do something for you guys, which was expert advice, amazing courses. Just because they're cheap doesn't mean they're any worse off than any other company, right? We believe that they're one of the best ones out there, but at the same time affordable. And then even then, if there's still a bit too much money, there's also the Medic Life bursary. Okay, so that was that. And then last summer, so before around April time, I went on my elective. So that was at the end of med school, near the end of med school. I was very fortunate to be given a scholarship. It was a Christina Swain Trauma Fellowship, which is known to be one of the best trauma kind of bursaries, even if you will, in Europe. That's how it's seen. And I spent almost 3 months in total in 2 different places. So that was South Africa, Johannesburg. I went there to get some additional medical experience. And then in December prior to that, I went to Phoenix, Arizona to learn tons of stuff. Okay, so that's a little bit more about that. And again, I'll explain some more things when I go into the Q&A session about what electives are, because a few of you guys have asked about electives. So you don't actually have to take a year out. You actually do them as part of your either 4th or final year of medicine. Prior to that, I used to have a YouTube channel. So I used to have a YouTube channel on cars. That's another thing. So some of the questions I was looking at throughout the talk, you guys were asking, you know, how do you manage your time and things like that. And yes, medicine is tough. Yes, being a doctor is difficult, but you definitely, if you organize yourself right, you can pick and choose a few things that you really love. So for me, you know, that was like my downtime. That's how I used to de-stress, go for a nice drive or something like that. But the reason I put that picture in there, I'm going to come on to as we go back towards that 6th form days. I also intercalated in my 3rd year with the London Air Ambulance. I did a pre-hospital medical degree. So because I went to Barts, they have a program with the London Air Ambulance, which is based at Royal London Hospital. It was an amazing year, got to learn so much stuff, and it's kind of shaped my entire career. What I want to do long term is hopefully one day become part of the Helicopter Emergency Medical Services, which I think is absolutely amazing what they do. All right, so going back another year, going back another year and a half actually, going to 1st year of med school, was the first time I actually went up to the helipad. There was a training day that I took part in, and you know, that again, it's completely fine if you don't know early on what you want to do from your career. Okay, it's perfectly fine. So I found out quite early on. I know a lot of my friends who still don't know, and that's fine. That's okay. So once you don't always think that you have to come up with an answer when it goes to interview. You know exactly what you want to do. It's good to keep your options open. As Bilal said, one of the best things about medicine is the fact that there's so many different varieties of jobs that you can go into as a doctor. So just be aware of that. Right, so this is the main reason I did this actually for the next 3 pictures. Okay, so now we're coming closer. So these things happened in my gap here, the middle 2 photos. So when I was applying for med school, and as Sun explained to you what they did, I was in a similar boat. So I didn't get into med school first time round. You know, I didn't do that many things. It sounds like I do a lot of stuff now. Of course I do. But back then, you know, I didn't do much. I was a very shy person. There's no way I could have done an event like that. And although I did very well in my academics, again, another point Ailey mentioned is your academics don't mean everything. It's a lot of other stuff too. I actually wasn't very good at my interviews. So even though I got some interview offers, I didn't actually get an offer into med school. Whereas then I had to take a gap year. It's something that I didn't plan. Although going back again, like the guys were saying, I would highly, highly recommend it. So if you have the opportunity to do that, by all means do it. But also, some of the best things happen from your failures in a way. You know, again, my gap year allowed me to work in a blood donation center, which allowed me to then learn skills when it comes to phlebotomy, skills that I use every day of my job. Even yesterday when I was working, 2 of my colleagues couldn't bleed their patients. And they, you know, after attempting a few times, they asked me to come and take that blood. And this one girl who no one could bleed her after 6 attempts, I managed to get it first time around. And I'm not saying that's because, you know, I'm amazing or something like that. It's just because of those extra experiences. I used to take so much blood that it's helped me get quite good at it, which means now in my daily job, those things have come back to make a huge difference to not only me, but also to my patients. So yeah, so one thing I just wanted to like kind of touch on that, and I think that is quite important to me, especially going on from Nav's well-being talk. You guys are going through tremendous amounts of stress right now. COVID wasn't enough, lockdown wasn't enough, and now here you go. You know, deal with UCAT and deal with applications and all these things. So I completely understand what you guys are going through. Just remember, you're not the only one. Everyone's going through it, so don't feel alone. Talk to your friends, talk to your family, and things like that, and do something to de-stress. Pick a hobby, do something that just kind of helps you relax a bit. Even when it comes to UCAT preparation, don't burn yourself out. All right, so those are my main tips about just general well-being and life stuff. What I really wanted to talk to you guys about is basically UCAT preparation. Okay, so a lot of you guys have asked me to give you guys some more tips about it, so I wanted to focus on that, and I've got some amazing news to share with you guys. So I've been trying to make this happen for a while now, for quite a long time, and since we started the Medic Life, I have tried to get to a stage where we can help you guys as much as we can. And Medic Life courses have been doing really well. We've been selling out all the courses so far, done 3 completely sold out courses, and I know we had technical glitches here today, but we use a completely different software for the UCAT courses, and Zoom works a treat. Never had that before. So the fact that YouTube Live, it's kind of put me off YouTube Live, which obviously is only for large free events. You would never pay for an event like this. So yeah, what I want to talk to you guys about is, again, first thing, and I think this screen kind of just gives it away. We are very happy to announce that the Medic Life is now working with Medify, which is a very well-known question bank, one of the best ones out there in my personal opinion. It's actually the question bank that I used myself when I was at your stage. That's how long they've been going on for. So we've teamed up with Medify, okay? So the one-day classroom course that we run, so it's currently 45, previously it was £45, and it's designed to be one of the cheapest, one of the best sort of resources out there for you, in my personal opinion. Now, bear in mind, been doing this for years, I've taught almost about 2,000 students. There's a difference. There's some sort of movement going on right now, which is kind of deferring people to even pay for any courses at all. And I completely understand that, What I'm not saying is that you have to pay to get yourself a good score, but it's important to remember that a lot of things in life generally, when you put in so much work as we have done, even in this event, for example, it's very easy to kind of lose your dedication and motivation over a few weeks, months, or even years. So having that incentive of the small cost to cover just the cost of running events, or even taking a day off work to work here, that's exactly why we charge such a low amount, just to cover that cost level, basically. And again, for people from low income backgrounds, there's the Medic Life bursary, which I'll come on to. But I'm just very happy to announce the fact that we're now working with Medify, which means when you come along to the course, it's a one-day course. We start at around 10 in the morning. We go to about 5:30. We go through all the tips and techniques that you need to score better on the UCAT. You can then practice all those techniques that you've learned, tons of them, with Medify's question bank, which I think is an excellent resource to add on to the Medic Life UCAT course. You've got 8 mocks, 18 mini mocks, which you can kind of spread out. And obviously when you come along to the course, I will tell you guys exactly how to even out your preparation over the following weeks. And then Medify have also thrown in a free personal statement writer app, which they normally goes for about £10 on their website. So altogether, what basically is happening is when you come along to the UCAT course, so there's 2 options now, and I've represented that on the website. This actually happened last night. I was on the phone to the COO at Medify, and we managed to work with this all together. So I'm yet to make changes for all of the events. But now, when it comes to the Medic Life courses, I've another thing to point out. I've released a new date because the next course on the 12th of July was pretty much already sold out. And I know after this, a lot more people are going to want more courses. So I've released a new date, Wednesday the 8th, which was my only day off from now until next weekend. But you know what? I know demand is high, and you guys really want to learn how to do better in the UCAT. So kind of giving up my day off. But yeah, so there's going to be 2 options from now on. You can still come along to the Medic Life normal course as everyone else would, and that's going to stay as the £45 that they did. Or we can add on an extra 40, so to give you guys a 1 month subscription to Medify, their question bank, which is basically 20% off. Normally it goes for £50. So you're adding on £40 worth of stuff for a 1 month subscription of Medify, and on top of that, you're getting a free personal statement writer app with it. Okay, so altogether you're saving £20 there just by buying it as a bundle. And that is now active on the Medic Life website. So by all means, go over, check it out. I'm expecting that to go pretty quickly, so I'd hurry up. And also, as a special offer just for today and tomorrow, if you use the Work Experience 2020 code, you will get £5 off. And that's basically coming out of my pocket, right? That's basically giving you guys an extra bit off, because I do want these things to become super affordable for you guys. No one should have to pay a fortune. One of the main reasons I left the company I used to work for when I started the Medic Life is because I had students paying in excess of £100 an hour for tutoring. I taught those students. And yes, these techniques make a difference. I don't think that they should only be limited to the people who can afford those kind of prices. So what I would like to do is offer that to everyone. You know, you don't have to be super rich to be able to learn these techniques which allow you to have a better score. Anyone should be able to come along. That's why this is called my course, and the Medic Live UCAT course, the online one, is designed the way it is. One more thing I wanted to talk about, guys, before we go on. So make sure you take a picture of the screen if you're signing up today, and I would highly recommend. So this code is going to expire tomorrow. So it's only here for a day and a half, really. One more thing is the Medic Life one-day MMI course, which Sun touched on. So these were launched last year. A lot of work went into it. So we got senior medical students, dental students, Sun, obviously, the dentist who leads most of the dental staff, and then a lot of other junior doctors or specialty trainees as well that run these courses, and they give you tips and techniques throughout. So you'll have 2 mock mini MMI circuits. So multi-mini interviews, basically mock of the circuits. One in the morning, one in the afternoon. You'll learn tons from both. Number of stations is about between 8 to 12 stations that we do, which cover a broad spectrum of universities. We have a big network of questions and like kind of getting feedback from students who go to other universities, the kind of questions you're likely to be asked from the universities you've applied to. So it's tailored to kind of give you the skills to improve your interview techniques. So more on that later on. Let's just deal with UCAT for now. So that's going to be coming back this winter. We're going to probably start putting those up on our website in October time, maybe even a bit earlier. Right, guys, honestly, thank you so much for watching. Now, a few more things I just wanted to take you to is, first of all, I'm just going to tell you now how to get the certificate, because it's a bit difficult to get it out to all of you guys. We would highly appreciate your feedback. Now, I know there's been some technical issues. You can talk about it if you want, but to avoid everyone saying, oh, the sound didn't work, blah, blah, blah. If you want to leave that out, fine. If you want to talk about it, fine. But I would love for you guys to fill in the feedback. The email you were sent an hour before the event started at 6, so you would have had an email in your inbox at 5 o'clock today. It was an automated email that has a link for the feedback form, okay? I want you guys to go to that now. If you can, go on that link, and you'll have a short feedback survey. It will take maximum 3 minutes, if that, 2 minutes even. And once you fill that in, you will then get a link to download the certificate. Okay, so please fill in the feedback. This is incredibly useful, not for just myself to improve these courses further, but it's super useful for Sun, Nav, Neeli, and Ailey, and Bilal as well, to add to their portfolios that they've done something like this. They've done this to help you guys out as much as they can. So giving them feedback so they can improve, and also going forward into their careers, feedback as you guys will learn when you become medics and dentists is a hugely important thing. So whilst you guys do that, I am going to start running through the Q&A session. I'm going to change things up. I'm going to get some of the guys back as well, so we can pose questions to the entire panel. I know it is getting late, so we'll do 20 minutes maximum worth of them, so taking you guys to 9 o'clock. So please, if you don't know where the link is, if you don't have the email, may have gone into your junk folder. The link is in the email that was sent to you at 5 o'clock today. So that's to fill the feedback form, and once you've filled it, you will be able to then download the certificate, which you can keep secure when you're applying for medicine and dentistry. So I'm gonna take this off, and I'm gonna bring the team back. So what we'll do is, guys, if you wanna all come back to Zoom, and I will start posing some questions, and then we can answer them together for our lovely viewers. And I'm gonna change over the screen as well. Right, I think, Ailey, I'm going to give you the first question if you're happy with that. A lot of people have been asking in terms of, is it possible, because obviously we know that graduate entry medicine is quite intense, it's the first 2 years kind of put together. Is it possible to be able to do a job alongside graduate entry medicine? What do you have to say about that?
So I've done a job, as some of you will know, and I'm very lucky because the company I work for is Medify, and they're really good with how I balance my work. So if I've got exams, I don't have to work much. So I think it depends, on your employer. I know some people that work in bars, if you've got an employer where you can just say, look, I need 3 weeks off, then that's great. I don't think it's not doable, but I think at some point you will have to sacrifice potentially not coming in the top decile. Mm-hmm. So you just have to weigh up what's more important to you. It's doable, but if you want to come top of the year, it's still doable, but it becomes a lot harder. Yeah. So yeah, I think it's possible, but it's just a case of weighing it up, what the job is, when it is, how much it is. There are people in my year that work, but I think we all struggle and we're all worried. So it's just whether you want that extra bit of stress. Yeah. And there are ways, like I said, to get more funding from student finance. So if you can avoid it, I would. But it all depends on your personal circumstances, I think.
Yeah, brilliant. Thank you very much. And then Bilal, one for you. You did mention that you have to make a lot of sacrifices and things like that. Is that something that happens a lot, or is it something that happens, every now and then? Because I mean, from my personal experience of, I've only been working for just coming up to a year, whereas you've been working for 5-6 years now as a doctor. What I have noticed is that because, like things you were saying, that you go to work, you work with your friends, you have such a good time, it's such a rewarding career, that even days when you finish late, yes, we joke about that you finish late most days, but a bad day is a day when you finish like 2, 3, 4 hours late. But my personal experience is, because the job is kind of so much fun and you're still there with your friends, it doesn't even feel that bad. Well, what's your perspective on it? I mean, you've been doing it for longer. Do you get tired?
I think it's different for everyone, really. Like when I was in F1, when I was in F2, finishing late or working on the walls with your friends, it is fun, and you often don't mind finishing late, which is not a big problem. I think when you mention sacrifices, I think it depends on what is important to you. Mm-hmm. So for me, those sacrifices often meant not being able to attend family events, or being with my family, you guys, my mom, my brothers, going out for dinner, and small things like that. Often I've had to miss them where I've finished late, or often I've had been working, because I work 1 and 2 weekends. So my rota is very different to someone who might be doing a different specialty. So every other weekend I'm working. So it's the sacrifices I make. I don't mind personally what I'm doing, but it's more that it affects other people.
Okay, brilliant.
And that's the thing that is important to me. So if you might have something else important to you, that you need your evenings free. So if you're finishing late, that might be a big sacrifice for yourself. But for me, if I'm finishing late, that doesn't bother me too much, because that day is already my work day. So if I finish late, it doesn't bother me too much in that regard.
Thanks. And then another question for you guys, Sun and Nav, actually, is something that I can relate to myself as well. Is how do you pick and choose what things you want to do? Because we're always so busy. And I think personally, if I think about it myself, is you can't, when you become a doctor or a dentist, or even when you're at med school, and I'm sure Ailey, you agree with it too, and then Neely, you do too, is when you want, as you grow older, you just get busier and you have more and more things to do. You kind of have to pick your favorites that you want to keep going. Like for me, the medic life means a lot to me. So even my days off, I'm always working on it. And in a way, that's how I relax. I like to exercise a bit, go for a nice drive, those things. What do you guys do? And also, is it different in terms of how busy Nav is as a doctor and how busy you are as a dentist?
Can I take this one?
Yeah, I'll just say this. But yeah, in terms of figuring out what you want to do, you're literally asking the wrong person. I have the most commitment issues when it comes to dentistry in all of my life. That's why I literally do everything that comes my way. Clean your room? Yeah. Extract his tooth? Yeah. I'll just do it all.
Oh, but floss your teeth?
Yeah.
Nah, this guy never floss.
You know how it's like 4 out of 5 dentists recommend Sensodyne? I'm the 1 in 5 who's like, no, bro, don't worry about it.
You're more like on the fence.
Yeah.
I'm
on the fence about Sensodyne.
Anyway,
yeah,
20 minutes.
You go 20 minutes.
Jeez. Okay. All right. If you're going to be pragmatic about it, you can balance everything in your life on a spectrum from I enjoy this is good for me in terms of a career. Everything you do is a balance between work and play. The key is to try and find something that you enjoy that is good for you career-wise, so it works well for you in that regard, but also you enjoy doing. For instance,
Teaching. You're going to say teaching.
no, I wasn't going to say
Oh,
teaching.
you wanna go-
Although that is one.
Yeah.
So, all right, I'm just going to pick one thing that I do. So, Nest is an organization that I purely did at Newcastle. Ailey might have heard of it, actually. Didn't realize we went to the same uni. That's cool. And it's, yeah, that was a strong head shake. Maybe not as famous as I thought it would be. So, it's an organization that just helps with refugees that coming into Newcastle, displaced from different backgrounds, and you simply just teach them, right? I enjoyed teaching. You did get it right. I guess in some respects, that's good for me in terms of a career. I develop people skills. I've got something to do. I can get involved in leadership opportunities. So you can spin it that way. But at the heart of it, the reason why I fit it into my schedule is because I enjoy it. That career stuff comes with it. So to answer back to one of the questions that I think came out of that is, how do you manage to balance those things? I guess you got to find stuff in your life that you enjoy doing. Find the career spin to it to make it efficient and useful for you long term. And that's the real way to balance things. But if that's too much, honestly, life's too short to get too worried about that other stuff, right? You just enjoy it. Try and enjoy what you do while you can with what you have. You know, that's probably my answer to that.
The way I put it is, regardless of, especially there have been times when I've just been so busy. There was a time in uni where I was so busy with some of the committee stuff I was doing, my dreams would literally be the emails I need to send when I wake up, right? That's where it got to that level where I was just like, hold on a minute, that's a bit weird. That doesn't sound healthy. But honestly, that was my most enjoyable year in uni. It was my fourth year. And the reason why is everything that I was involved in, I was really passionate for. And fundamentally, you make time for the things that you believe in, 100%. So for me, the reason why I love what I do so much is because, and the reason why I'm willing to do all the long hours for it is because I love what I do. And don't get me wrong, there are definitely days where I'm grafting and like, oh man, this is so tough. But you take the bad to get to the good. And I realize I'm going on a tangent here. So in answer to back this question is, you make time for the things you enjoy.
Can I share one pro tip? One pro tip. How long were you talking for?
Right.
You serious? Right. All right. With all the stuff that you do, though, managing expectations is key. So if you find yourself inundated, have so many things to do, maybe tell those other people that you're going through a tough time or you need a bit more time, etc. You'll find more often than not, people have your back and they're understanding. If you've bitten off more than you can chew, just be honest about it. Hold your hands high and say, yeah, you know what, I've got a lot of stuff going on, guys. I might come back to this later. I'm really sorry about that. And just give them a heads up. That there's nothing wrong in that. You know,
and that works well when you start working on the wards as well. When you got too many jobs and then you get another bleep saying, can you prescribe these fluids? You can like, you know what, I'm going to go see...
Or water, in your case.
Oh, yeah. To drink.
Where in dental school do they say, son, you're going to manage a bleep for a day? I'm like, no, please. What?
All right, the next question is for Neely. So Neely, I've got a question that someone's wondering. So there's two parts to it. You can answer one at a time. Firstly, what's the maximum pay bands a physician associate could get to? Because you mentioned about how initially physician associates get paid more than doctors do, but then later on, doctors can then career progress a lot more and get to a higher pay band. What about physician associates? And secondly, can physician associates operate as well alongside the lead surgeon? Because I know that there's some opportunity to work in secondary care. Can you then get into theatres as well if someone's interested in surgery?
Okay, so in terms of income, I know of a physician associate who's earning 80 to 90,000 a year, but that's because they're in central London and they're working as a practice partner in a GP. You guys are so distracting.
Aren't they? I think all of us were just like, what? We want to be PAs now. But anyway, sorry, carry on. We're like, we went into the wrong career. What are we doing here? But yeah, sorry, carry on. I won't disturb you.
Commonly, if you look at NHS Jobs website, at the moment, don't look at it right now because it's saturated with one specific company. But if you look at it as a whole, I mean, when I look at the NHS Jobs website for PAs, the average salary for working in a hospital is around 40, most likely 50,000. But if you want to work in a GP, it's slightly less, around 37.5 to around 40 something. It starts there. as you progress, so as we will be regulated by the end of next year, or this year, sorry, we will probably gain prescribing rights, and so we'll be able to take on further training and have more responsibility. So naturally, our salaries will increase. I think if you have a yearly appraisal, they should increase your salary. We have to read your contracts really, but I mean, your salary should increase.
Yeah.
As per experience. In terms of whether or not you can work as a lead surgeon, probably not. I know of quite a lot of PAs who went into surgery and they enjoyed it so much.
I don't mean as a lead surgeon. I meant, can you assist?
Medicine.
Can you? Sorry to disturb. I meant, so I think the question was, that was asked, and I failed to translate it properly. Can you assist with a lead surgeon? Like, can you assist a surgeon who's actually done medicine and everything as a PA? Can you assist them?
Oh yeah, there's so many jobs working in the surgical theatre rooms. Even as a student, I mean, it's quite. I mean, I don't know if it was Sun or Nav. One of you guys doing Max Facts. So I actually, as a student, there's a lot of competition. So if you are in the surgical rooms, there's obviously either DCT 1, 2, 3, whoever. There'll be a registrar. There'll be a consultant. There'll be medical students. And PA students and nurses.
Yeah.
So there is a lot of competition getting involved with surgery, but it is doable if you find yourself in a job working in the surgical theatre rooms. Yes, of course you'll be
I think
involved.
it's nice to know that there is that option available. So
Yeah,
thank you very much. Thanks for that. Bilal, I think since you're the one who's been working the longest out of all of us, I think a great question that someone's asked is, what would you tell yourself if you're going back to the sixth form days?
You're basically telling me I'm the oldest out of all of us.
Yeah, basically. And I can do that, and I can get away with it. So yeah, go for it.
So, sorry, say the question again.
So the question is, what would you tell yourself, or what would you do differently if you were back at the stage where most of the viewers are right now, thinking about applying for medicine or dentistry?
I think Sun and Nav, guys, your presentation was absolutely fantastic in terms of giving advice to students, and it was mainly do your best. This is a hugely stressful time, and if I was to go back and tell myself, don't be stressed, you will get a place, everything will work out fine, I probably wouldn't take that advice, because I know whatever I do, I would be stressed. But if you've done your best, and if you've given it your best shot, and you still haven't been able to get in, try again next year. It just wasn't your time. So there's no loss in that. There is no loss in losing a year or two in a healthcare field where you'll be working for 50, 60 years. You'll be spending most of your life working. And if you want to take an extra year out of the gap year, or even when you become a doctor, like we were talking about, taking a year out after your foundation training, there is no harm in that. And even myself, I am taking a year out from August.
He's really looking forward to it. He's excited about that, isn't he?
I am excited. No more working 1 and 2 weekends. Thank you very much. But when you do these things, you come back refreshed, and you come back with a clear mind, ready to enjoy what you're doing.
All right. So another question we've been asked, and I think that's mainly for us graduates anyway. Sorry to exclude you guys for a second. But does the workload ease off when you start working as a doctor or a PA? As compared to a uni, because I know, Ailey, you were talking in your presentation how much work and assignments and all those things there are. And I know personally, I think we counted 42 exams whilst I was at uni. Does that ease off? Does that ease off ever? I mean, I know, so just my take on that before I let you guys speak as well, is that what I find is the best thing about me being a doctor now compared to when I was a med student is I come home after work and I've got nothing to do. I don't have to revision. I don't have to revise for exams, and now anyway, because there are postgrad exams. But that time is mine. I get to do whatever. Whereas, when I was at uni, you come home and you're like, oh, God's sake, I've got an exam. I've still got another 5 hours of revision to do. What do you guys think about it? I mean, Sun and Nav, what do you think? Keeping it short this time, by the way, and you might want to unmute yourself.
So I fully realize the whole point, like when you're going to uni and you're not really studying, especially when you're in final year and you have exams coming up, you feel guilty when you're not studying. But literally, when I came back home and I moved back home after uni, I'd come back home and be like, I don't have to do anything. I'm just gonna play Halo all night. Yeah.
Very weird.
But I think things do change though, and if you end up going for like specialist posts and training posts and things like that, then it kind of switches and you're supposed to be doing extracurricular stuff. So for example, this is something that might take up my evenings and you have to prepare for this, but it's more things of your own volition rather than you have to prepare for some exam that some deanery has set. So yeah, in a way, it's a different kind of work.
Cool. Thank you. And then Ailey, I know you, again, coming back to you regarding how tricky the graduate entry, especially the first year, and how many assignments there are and things. I mean, going from, undergrad degree straight into graduate entry medicine must be quite stressful as well. How do you deal with all that stress?
You mean specifically from going 2 degrees?
Or just generally the stresses of, whatever you're experiencing in your life, right? Like graduate entry medicine. Also, you mentioned you're working for Medify. You're doing quite a lot of things. I know you're very active on social media too. So, as we do more things, we get more stress. What do you do to manage all that?
I think, like I said, working with friends is so important. So the boys mentioned earlier that you do kind of problem-based learning, and you have so much work, and you might be someone that doesn't, at the beginning it sounds awful, but I didn't trust other people's research. And I used to just be like, no, I want to do it all myself and I want to learn it myself. I think you've just got to trust that, just the way that you must do as a doctor, that you've got to work with other people, and actually they can be an amazing resource. So I think don't put too much pressure on yourself to do loads of work. You can't do everything. Also, the reason I also haven't done that well, probably, like obviously I've passed, but I'm not top of the year, is because I have had a social life. I go out quite a lot. I actually think that's really important if you're a social person. Having hobbies, societies, like they mentioned earlier as well. I will say you won't have loads of opportunity to do societies. I think also take a break from medicine. Like for me, it's what the boys were saying earlier. I would go to sleep doing flashcards, and I would wake up in the middle of the night in like a sweat, and the first word that would come into my mind was like an anatomy word. And then I just started to realize, I was like, God, I'm doing medicine. When I see my friends from home, I'm talking about medicine. All of the societies I'm in are medicine societies. I have a medicine blog, and I was like, I've just lost my personality. So I think you just do some things that you enjoy, like go for a run. And those small things like exercising or a hobby that is just so separate from medicine is so important, because the graduate year just will take over your life. You will live and breathe it. And that's not a bad thing, but just try to keep that sense, any sense of normality.
I think that's very important as well. Even not with just graduate entry medicine, but even when you become a doctor or whatever, just holding on to something that you love doing. Like I was saying to you guys earlier, I love going on for a drive or running or exercise or whatever, because I can relate to that. There have been days when my morning alarm goes off, but just before I wake up, I dream of my bleep going off. And that translates. So my brain, just because it translates like, oh, your bleep's going off, and then I wake up like, oh, that's actually my alarm. So yeah, that kind of stuff, it happens. So to stay sane, it is very important to do stuff that you enjoy. And I would say, when you get to uni, please do hold on to that. Join a society of stuff that you love. Like, I really love to play badminton, so I've joined the badminton society, and I know each one of you guys have done something similar. I know Sun and Nav did so much stuff. They also joined fencing, which was something new. So try new things, also hold on to things that you love. So I think that is super useful. Guys, I think we'll stop it here, because we're now hitting 9 o'clock and we should send people to just do something. We've taken their attention for 3 hours. I would just like to say a huge thank you to every single person who's joined the event, but even more so to you guys. Thank you so much, Sun, Nav, Ailey, Bilal, and Neely. You guys have had, done such a great job helping all these students out. So I know we had a few technical glitches. Hopefully we've given you guys enough information to make it useful in some way or another. What I'm going to try and do is, because I know there were glitches, is I'm going to try and compile the videos together, so people who couldn't watch them due to that, and also the event running an hour longer than it should have done, you guys may be able to watch it later again. Okay, so that I'll send you guys out emails regarding that. Make sure you fill in the feedback so you guys can get your certificates. And very excited about the new partnership with Medify, the Medic Life courses and the Medify bundle. It's going to be amazing. That is now live on the website. And you guys, again, just to remind you guys, Work Experience 2020 for your £5 off. But honestly, you guys, have a good night. Thank you, you guys again, all 5 of you, for being here today. And we will hopefully do something similar without technical glitches next time. So yeah.